ServSafe Quiz, Chapters 13-15, Exam Questions. Training need. A gap between what staff should know to do their jobs and what they actually know. Integrated Pest Management Program. A system that will prevent, control, or eliminate pest infestations in an operation. Benefits of self-inspection. Safer food, better quality food, cleaner environment, higher inspection scores. Inspection frequency. Once every 6 months. Considerations when using pesticides. Apply only when business is closed and staff is gone. Prepare the area to be sprayed by removing all food and movable food contact surfaces. Cover equipment and food contact surfaces that cannot be moved. Wash, rinse, and sanitize food contact surfaces after the area has been sprayed. Storage, disposal. Infestation. Pests entering a food operation in large numbers. Flies. Can spread pathogens such as Shigella. The FDA Food Code regulates what type of establishments. Restaurants and retail stores, vending operations, schools and daycare centers, hospitals and nursing homes. Health inspectors, sanitarians. Conduct restaurant and food service inspections. Public Health Service. Assist the FDA, USDA, and state and local regulatory authorities conduct research into the causes of foodborne illness outbreaks. Assist in investigating outbreaks. The 3 basic rules of an integrated pest management program are: deny pests access to operation, deny pests food, water and shelter, work with a licensed pest control operator. Core item. Remaining provisions that promote sanitation and good retail practices. Minimum screen area to control pests. 16 mesh per square inch. Priority foundation item. Are those that support priority item X having soap at a hand washing sink. Air curtains. Devices installed above or alongside doors that blow a steady stream of air across an entryway, creating an air shield around open doors. Included in a service contract of a PCO. Service description, period of service, your duties, records the PCO must keep. 3 risk designation when evaluating operations. Priority items, priority foundation items, core items. USDA inspects what products? Meat, poultry, eggs. Food codes. Food safety provisions that regulate retail and food service operations. Forgetting curve. A graphic depiction of how recall steadily declines over time. Center for Disease Control and Prevention, CDC. Federal governmental agency that investigates food illness outbreaks, studies disease control. When do violations of priority items need to be addressed? Within 72 hours, priority foundation, 10 days. Priority item. A provision whose application contributes directly to the elimination, prevention, or reduction to an acceptable level hand washing. U.S. Department of Agriculture. A governmental agency responsible for inspecting and rating meat for freshness and quality. Address these to prevent pests. Doors, windows, vents, screen, air curtains openings, pipes, concrete, grates. Pesticides. Chemical agents used to destroy pests. FDA Food Code. Science-based reference for retail food operations on how to prevent foodborne illness. Responsibilities of regulating food safety. Inspecting operations, enforcing regulation, investigating complaints and illness, issuing licenses, approving construction, reviewing HACCP plans. Food and Drug Administration, FDA. A federal agency charged with enforcing regulations against selling and distributing adulterated, misbranded, or hazardous food and drug products. Pest control operator. Licensed professional who uses safe, current methods to prevent and control pests. The FDA inspects all food except meat, poultry, eggs, signs or rats and or mice. Gnawing, droppings, urine stains, tracks, nesting material, holes. Signs you have a roach problem. They are out in the day, oily odor, droppings, capsule-shaped eggs that are dark in color. Examples of immediate closure. Lack of refrigeration, backup of sewage, fire or floors, infestation, interruption of electrical or water supply, foodborne illness.